With cases of depression expected to increase during this COVID-19 pandemic, there is a call for healthcare providers to do more screening for mental health issues. Shamela Pullen tells us more in this evening's edition of the Health Report.
As cases of COVID-19 continue to rise locally, so are the cases of depression, especially with people in quarantine and the stay-at-home order. Consultant psychiatrist and president of the Psychiatric Association of Jamaica, Dr. Earl Wright, says it is estimated that at least 30% of the Jamaican population will suffer from depression due to COVID-19. As such, Dr. Wright is urging family physicians to do more screening for depression.
So if over the past month you have been feeling very sad, unhappy, you're not enjoying life anymore, you're having crying spells, you're not sleeping as well as you used to, or you're sleeping too much, change in appetite, and you can't watch the television show that you used to enjoy.
Dr. Wright says with COVID-19, persons' mental state has been deteriorating. He says there are instances during this pandemic where persons in other countries have committed suicide. He says he does not rule out the possibility of that happening in Jamaica. Dr. Wright says persons working on the front line are most at risk.
And especially health providers. Health providers are especially at this time at risk. So I know that the Psychiatric Association, the Psychological Association are providing whatever care possible so that individuals, healthcare providers, and others don't get depressed, or if they get depressed, it's effectively managed and they get the support that's needed.
The psychiatrist says recognizing the symptoms and getting treatment early is critical. Dr. Wright says talk therapy, which is a part of treatment, can be done among family and friends, but that is just one aspect of treatment. He encourages and outlines others.
One of the most important things in a time like this is exercise. Daily exercise helps to relieve the stresses of life. So going for a walk, being in the here and now. This time of year, you have a lot of flowers, you have birds around, nice sunshine, things that you haven't noticed for a while. Take time to notice them, living in the present, because if you keep in the COVID all the time, you're gonna get depressed.
With your health report, I'm Shamela Pullen wishing you good health.